after black fungus and white fungus, yellow fungus cases traced in India. Here we can solve common questions about yellow fungus, black fungus and white fungus. Which is more dangerous among black fungus, white fungus and yellow fungus? Doctors have suggested that a yellow fungus infection could be much more dangerous than black and white fungus cases, and requires attention from the very beginning, since it is an infection which can cause heavy internal damage. What exactly is yellow fungus infection? Yellow fungus infection isn't exactly new. A yellow fungus infection, much like other fungal infections, spreads via contaminated environments, or when a suspected patient inhales molds, mycometes, which grow in the environment. How yellow fungus is different from black and white fungus? What makes this infection different from white and black fungus infection is the manner of its spread. While black fungus starts off with distinct facial disfiguration, the yellow fungus infection starts to cause symptoms by launching an attack on the body's internal organ and disturbing vital bodily processes. Since the damage caused by the infection is said to be much more dangerous and severe, experts now warn people to start recognizing the infection from day one and seek help. What are symptoms of the yellow fungus infection? As per available case studies, following are the broad symptoms of yellow fungus infection: disrupted digestion, slow metabolism, unexplained unusual weight loss, pus leakage, loss of appetite, malnutrition, scrawny, sunken eyes, lack of energy, lethargy and fatigue, necrosis, in severe cases, delayed healing of wounds, prolonging recovery timelines. How does yellow fungus spread? Is it contagious? Fungal infections spread when a person inhales molds, and are found in the environment. Now, yellow fungus infections could also be spread via high levels of humidity, or presence of old contaminated food. However, poor hygiene and unsanitary conditions remain to be the prime reasons for infection. While fungal infections can primarily attack people with compromised immunity, yellow fungus or other fungal infections being talked about right now aren't exactly contagious, since they cannot be spread from person to person like other respiratory infections, including that of COVID-19. The risk of external spread hasn't been found or studied in detail as of yet. How can people protect themselves from yellow fungus? What we must remember is that we are only beginning to learn information about the new infection. However, like with any infection, one of the best steps to take is to safeguard your health. Compromised immunity helps fungal infections thrive. People suffering from uncontrolled diabetes, or with a history of diabetes, should be doubly careful of keeping their blood sugar levels under control. As for patients battling COVID-19, since one reason for the spread of these hazardous molds is unsanitary environments, one must ensure that proper disinfection is followed. Those on oxygen therapy should also ensure that oxygen is well filtered and not contaminated, such as with unclean water. Indiscriminate usage of steroids and related medications should be curtailed. Additionally, doctors and specialists recommend that any at-risk patient not expose themselves to the risk unnecessarily, follow proper mask mandates, and maintain personal hygiene. Wearing clothes which do not expose the skin to probable contaminated surfaces may also go one step further to protect you. Is black fungus affecting only COVID patients? Mucormycosis, colloquially known as black fungus, is a serious fungal infection that was seen in far smaller numbers in India before COVID-19, too. But it is now affecting post-COVID patients in large numbers. Mucormycosis is a fungal infection mostly found in patients with compromised immune systems. That is, it can affect patients other than post-COVID patients. Is there a cure for black fungus? Senior doctors of Delhi said that black fungus can be treated if diagnosed early. It can be fatal if not diagnosed early and treated as early as possible. who can get infected by white fungus. Invasive candidiasis is caused by a yeast, a type of fungus, called Candida. Candida can normally live inside the body, in areas like the mouth, throat, gut, and vagina, without causing any problems. However, individuals with low immunity, like patients recovering from a serious COVID-19 infection, are particularly at risk of contracting this fungal infection. In their bodies, the fungus can enter the bloodstream or internal organs to cause an infection. How to know if you have black fungus infection? One must note the symptoms of mucormycosis. They include headache, facial pain, nasal congestion, loss of vision or pain in the eyes, swelling in cheeks and eyes, black crusts in the nose, coughing, bloody vomits, altered mental status. These symptoms will help you to identify the infection.